told Dr. Onco that I wanted to do the TC chemotherapy, the same as my friend Nina. I'm just concerned about the possibility of heart damage, and plus, honestly, like the lengthier treatment is less desirable.
I understand. We usually recommend TAC, but the risk of heart damage, while very uncommon, is valid.
So is TC as effective as TAC?
I already asked her that.
Well, I wasn't here.
Yes, it's as effective.
I'm asking the doctor.
You know, it's hard to say if one is more effective than the other, as there have been no clinical trials that put the two against each other.
See?
That's not what you said.
So, if I do the TC chemotherapy, we can always switch if it seems like it's not as effective, yes?
Yes. And of course, we would monitor your progress closely to see if a change would be necessary.
The other thing I need to talk about is egg preservation. I had already spoken to Nina and had come up with a game plan.
I don't know if my fertility was compromised by the chemo, but either way, I'm glad I froze my eggs. Having kids, is really important to my husband and I'm glad I had an insurance policy. That being said, it was extremely stressful.
I had a lot of questions. Google?
Yes?
Why is fertility affected by chemotherapy?
Chemotherapy targets rapidly multiplying cells, such as those in tumors, hair follicles, and the reproductive system.
How can I tell if my fertility is affected by chemotherapy?
Well, most women cease to menstruate while taking Cytoxan, the C in TC chemotherapy.
But they get periods again when they finish chemo?
Some do, some don't. 10 to 20% of women lose their fertility as a result of this treatment.
Okay. So, did your insurance company cover your fertility treatments?
No! Almost no insurers cover fertility treatments.
Seriously?
Virtually no private insurers cover the cost of fertility for women. However, 90% of insurers cover the cost of Viagra.
Why are you telling me this?
Well, you asked me about infertility.
You know I'm not having problems getting it up, right?
I know.
Yet you're still showing me ads for erectile dysfunction pills.
Yeah, I'm Google. It's kind of my thing.
So, how expensive are these treatments?
One round of preservation can cost upwards of $20,000, but that includes the doctor visits, medication, egg storage, and the actual egg draw.
Yeah, I can't afford that.
After I was treated, I discovered an organization called Fertile Hope. It's funded through Livestrong and works with IVF facilities to offer discounted treatments to cancer patients.
So, I found a fertility clinic in New Jersey that participates with Fertile Hope. The cost of treatment will only be like $2,000 plus medication and labs, and I'm going in for my first visit tomorrow.
And you still want to do chemotherapy first instead of surgery?
Yes, why?
Well, if you do egg preservation, then it's going to delay the start date of your chemotherapy.
Is that a problem?
Well, obviously we would like to start the treatment as close to diagnosis as possible, but if this is important to you...
She's not going to risk her life for it.
I'm not risking my life.
She said you should be starting chemo as soon as possible.
Yeah, so is a 2-week delay a matter of life or death?
I do not believe that the delay in treatment is going to affect the outcome.
Cool, great. So I'm going to do egg preservation, and when it concludes in 2 weeks, I am going to begin with TC chemotherapy.
All right.
Okay.
Awesome. Can I use your bathroom before I go?
Of course.
I knew that boyfriend was trying to be helpful, but it's not like I was doing anything reckless. I mean, I had done a ton of research before making suggestions to Dr. Onco. Suggestions that...
I just want to make sure Jacey isn't...
Hey!
Hey.
Yeah, we're leaving.
Thank you so much,
I'll
Doctor.
talk to you soon.
Talking to my doctors behind my back is fucked up.
I am concerned about you. I think that's entirely valid.
You do not determine my treatment.
You don't determine your treatment either. You are not a doctor.
I'm well aware. That is why I am going to be seen by doctors.
But you pressure them.
No. Look, I'm aware I'm pretty solid at arguing, but I sincerely doubt that a trained medical professional is going to put my life at risk simply because I make some suggestions. Suggestions that I might add are based in thorough research.
You have a way of getting what you want.
Really? Awesome. I want this conversation to be over.
Hey, so I made you dinner.
Really? That's so nice, but... Great. So, what is this?
Cabbage. Cancer hates cabbage.
Says who?
Patients, doctors, basically everyone on the internet. Also broccoli. Cruciferous vegetable consumption may actually kill cancer according to some studies.
Okay, what's on it?
It's American cheese seeds. They may help reduce your risk of recurrence by up to 54%. Green tea may similarly reduce your risk.
Where are you getting all of this?
Not the only one who did research.